Kia ora tātou. Ko Adele Gautier tōku ingoa. He kai whakahaere rangahoaho mō Breast Cancer Foundation NZ. Hello and welcome. I'm Adele Gautier, Research Manager at Breast Cancer Foundation NZ. And today we're talking about Wāhine Māori and breast cancer. So, why a webinar for Wāhine Māori? Well, every year around 400 Wāhine are diagnosed with breast cancer in New Zealand. The good news is, when breast cancer is found early, it's very treatable. So tonight we'll kōrero about what some of those treatments are and some things that might help you get through it, including the role of the Māori cancer nurse specialist. You can see we have three manuhiri with us here tonight, and I'll let them introduce themselves to you.
Kia ora koutou katoa, ko rangi puta te maunga ko awaro te moana, ko māmari te waka, ko tahitanga te marae, ko te raroa te pauri ngā iwi, ko Ngāti Haua te hapu, ko tarai tuku whānau, ko Stella Williams. Taku ingoa. Kia ora everyone, my name is Stella Williams. I'm a clinical nurse specialist for Māori and cancer care coordination. Kia ora.
Kia ora everybody, thank you very much for having us here. Ko tainui te waka, ko wakato te awa, ko taupiri te maunga, ko wakato te iwi, ko Leanne Webaho. Kia ora.
Kia ora tātou, ko Taranaki toku maunga, ko Uranui toku awa no Taranaki aho, kei Tamaki Makaurau toku kainga inene, ko Thomas toku whānau, ko Ellen toku matua, ko Lorraine toku whaia, ko Karina toku ingoa. He nehi aho ki Counties Manukau Health. Hello everybody, my name is Karina and I'm a nurse specialist for breast cancer at Counties Manukau Health.
Great, well thank you all for being here tonight, and thank you to all you at home for joining us as well. We're just going to start off by asking Leanne to share a little bit of her personal story with breast cancer. Leanne, just tell us a bit about when you were diagnosed and how that happened.
Okay, so it happened back in 2019, about late October, and at that time I was 58, and yeah, so for me it was like most of us, it was a bit of a shock, but I used to run some health classes before that, and yeah, it was quite devastating because it was nearing Christmas and I didn't want my family going through any, to be worried for me. So it was about holding in that fear. And of course, at that particular time, everything was starting to shut down.
Yes.
And so it wasn't until about February, late February, that I actually was able to go and get help. Yeah.
Well, and did you know other people who had breast cancer? Anyone in your family?
No. In our family, my mum, aunties and that, they all died at an early age. Mm-hmm. But what we know today is that cancer actually does run in our family. Mm-hmm. And it's something that our younger wāhine, our younger daughters and granddaughters, they know now that they must, seek help, go for all their mammograms and things like that.
Great. So, Stella, do you tend to meet people at the stage where they come to the clinic having found a lump, or what? Tell us about the breast the Māori Cancer CNS.
Yeah, not a problem. Yeah. So usually when I fail wāhine will get a referral from a GP, so they'll be coming either that way or through the breast screening. That's another way we capture our whānau. So my role is to contact women like you, Leanne, and to introduce myself to you, so you know who I am, and to be sort of an anchor for whānau. If they have any questions around appointments or how to get in, I'm going to, address some of these other issues. and just to be available, you know, if they had any questions or concerns or needed to get a hold of the doctor or someone else, you know, I would be there for you so that you could get the support that you would need. So that's sort of where I sit into this.
So Leanne, how much did you tell your whānau at this stage, and were they with you during?
I was so terrified. And I think giving it a voice was the hardest part, because then I had to deal with it. But I knew what I knew, and I suppose before I told any of my husband, my daughters and that, there was a nephew. And I just had to talk to somebody. And so I spoke to him. And yeah, so he was able to give me that little bit of comfort, you know. But like most of us, I'd say it's not an easy thing to give voice to. But it's, you have to, in the end you have to. And the thing was is that although it was a shock for all of my family, and especially we were dealing with something that, you know, it was new to us. You know, cancer for my family and our experience, it was death. And so, you know, that was trauma around it. But medical science today, you know, you can get help. You can be helped. And this is where the people at the medical, well, actually, this nurse here, she was actually there. And I brought my whānau in.
Wow,
and it was awesome, you know, because the way they spoke, the way they, you know, they really made us feel it was going to be okay. But we had to work as a team.
So, Karina, on the subject of the team, there are often quite a lot of people involved in the clinical team, let alone the whānau side of it. So, can you tell us about who people might see at the hospital?
Yeah, sure. So, yeah, you will meet quite a few people when you come through the service. And firstly, my role is I provide supportive care, but like Stella does as well. We probably, our roles are similar, and we would link in with each other if we're in the same DHB. And yeah, providing supportive care and liaising and advocating and being there for our patients and their whānau from the beginning at diagnosis through the treatment. And there's other members of our team as well. So the surgical doctors, who will often be the ones that meet you when you come into clinic with a symptom to be assessed. And they're also, of course, the doctors that do the operations. Radiology doctors that interpret the images from the mammograms and ultrasound scans and other scans sometimes too. And they perform biopsies to take a sample of tissue to test it. Pathology doctors that look under the microscope and give us a name of what it is, if it's cancer or not, and what type it is, and what gives us a hint about what we need to do to treat it. Oncology doctors, which are medical oncologists, the doctors that treat cancer with medicine, which is chemotherapy or tablets, and the radiation oncologists, who are doctors who treat cancer with X-rays locally in an area to prevent it coming back.
And so, Stella, you sort of working with the breast team as well?
Yeah, so I wanted to jump in there because, you know, we were at the same DHB, would be working together to provide that holistic care for our whānau. I would know a lot in terms of like other resources to bring in, but I'll be there to support Karina and her team in terms of advising maybe if need be. I'll be there for you and your whānau because I could go out into the community, into your home, and we could even have kōrero around anything else that may be of concern to you or something you just want to speak about, you know, in your home. And I think that it's a really nice place for me to be, you know, with our whānau in their home where they feel more comfortable.
So, Leanne, in terms of talking to doctors and the medical team and so on, did you find that easy?
I think in the beginning it was more, it was a lot to take in. And so coming from our own cultural views, having my husband there, having my daughters there, they were able to take in. If I missed something, they would go along and say, oh no, it was supposed to go this way or that way, or help with, you know, whatever we were talking. And they were able to break things down a little bit, a lot more. Yeah.
And so then you had to make decisions around treatment and choices and so on. Did you feel there was much choice, or how did those conversations go?
So yes, there are choices, and I think although every single person that's ever, you know, had breast cancer, we're all different. But what isn't different is the treatment that's available here in Aotea. And so, but being a first timer, I think that the healthcare plan that we had, it was proven. There's a lot of success rates coming from it. And so, yeah, and there's a lot of trust there. Yeah.
Very much so, yeah. So, Stella, do you get involved in helping with that decision making?
Yeah, definitely.
Yeah.
I was just thinking what you were saying about trust, you know. I think for me, whanaungatanga is one of the biggest things that I could do with whānau, to make those connections and to build those relationships of trust, because it's a really foreign place to be in the hospital for us,
Yeah.
and really hard to navigate the whole system. So, you know, I'll be there to sort of guide the way, and definitely having those discussions, you know. And you're right, you know, when you're saying that sometimes you wouldn't see anything. So anytime the word cancer is mentioned, you know, I see a lot of people just start to glaze over. They don't hear anything else past that. So it's really important to have whānau support around you, just so they can hear what's going on as well, you know, and just add and to support that mahi that's been done. Yeah.
So what treatments did you end up having?
Okay, so I had 2 operations to remove. The first one was to remove the tumour. Oh no, hang on, that would have been biopsy.
Yep.
That's part of it, because I wanted to get it right. The next one was the removal of it, but the doctor came back and said that she wasn't comfortable with it, so she wanted to go back and then do another shape. So it was a partial. And after that, I did the chemo. Radiation was offered, but because I've got a bit of a crook heart, I thought, no, I don't want any more damage done to that, so let's go this way. And that's what I liked about the doctors, and that they were really, really, you know, they were listening. And then, of course, I do fusions, so I had about 16 of those. I'm halfway through those ones.
Right.
Yeah.
So just to confirm for people at home, so you just had the lump taken out of your breast, not your whole breast.
Yeah, that's right.
Yeah.
So that's what they call partial. Yeah.
Great. Okay. And in terms of going through that, were there any sort of times where you had to advocate for yourself? Were there any sort of glitches along the way?
Oh, there were perhaps 1 or 2, and I think it's only fair to say we are in COVID, and so, you know, hospitals had to be on, you know, I would say red alert around the type of care they were able to give everyone, and it was always the best. So my take at that time was, because I do suffer with anxiety and that, and so from day one I've always had my children or my husband awhine, and I went up thinking everything was all right, but at that particular time they had moved, I think it was chemotherapy, over to one of the other hospitals, no naming, and yeah, so that's what happened. And of course they couldn't have my daughter there, and that was very, very upsetting. But the good thing is that one of the Māori healthcare facilitators, I'll call her, she came and she was able to sort things out. Yeah, but other than that, care's always been, you know, always been with a smile, and yeah, very understanding staff.
Can I add an experience to that that's similar to you? And I know you would probably do the same thing. It's about advocating for our patients. During that COVID time, we had a woman who was going to come in with a diagnosis of cancer. And so she couldn't bring whānau support in with her. So they suggested that she come in and her partner stay in the car on the phone to get the diagnosis. And for me, that was heartbreaking. I said, no, this isn't suitable. This isn't appropriate. We tried to do the telehealth, but at that stage we hadn't set up our resources to do that. So the best thing that we could do for this whānau was have her at home, surrounded by her whānau, and having a telephone consultation. Nice. And that was the best that I could do for her at the time. And I think us as nurses will do all that we can to work with the family to support them.
Yeah, that's right. Yeah.
That's good.
So, Karina, we've heard about surgery and chemo and possibility of radiation. What are all those treatments meant to do for you?
Well, yeah, that's right. They are the three main weapons, I guess, we have against breast cancer. Surgery, which involves cutting the cancer away, either by a partial, which is just removing the lump with a rim of healthy tissue, or giving radiation later, or possible, maybe, or a mastectomy, which is removing the whole breast tissue with or without a reconstruction. As part of that package, most people will have their lymph node sampled as well, which can be either just a few or a larger bunch, depending on characteristics of the cancer and if we think it's spread there or not. So that's the surgeons that do that. Then the other treatments we have are when you go and see the medical oncologist that I talked about before, to talk about having chemotherapy, which is strong medicine that goes in the vein and goes all around the body to kill off any little cancer cells that could be circulating around, or anti-hormone tablets as well. These things depend on the features of the cancer when they look under the microscope. How fast is it growing? How big was it? Did it spread to the nodes or not? How old is the person? How well is the person? And those all, as you can see, there's so many factors to think of, and these all get discussed as a group at our big meeting each week, so we can make sure our recommendations are what we think is best for our wahine and their whānau. And then we would have an open discussion about those things together. The radiation oncologist as well, that's the other weapon we have, which is the X-ray treatment that we give to treat cancer locally and shrink it down sometimes as well. If it's
so locally mean the part of the body, not the part of town?
That's right. I know, that's being medical. Sorry. Yes, where it is, exactly, in the breast rib area. Yeah.
Right. Great.
Yeah, we come to you. Sorry. No.
And so some people also do some complementary therapies as well as their hospital type treatments. Stella, what are some examples?
Firstly for me, if you are taking anything, we need to know as a team, so it doesn't interact with medication that they may be on. I know that some Māori will be trying either miri, that's all the massage. There's rongoa, drinking maybe kawa teas, brewed, even just topical, it's pani, to rub onto your skin. So there's lots of natural remedies that Māori will look at, but also that sort of holistic thing, what sort of centres for you, what grounds you, whether it's going back home. My dad said if you're sick we need to go back home up to whānau, to be on your whenua and just to ground yourself. So people might have that. Could be going to the beach, it could be going into the bush, just whatever works for you, whatever settles you, I think.
Yeah. Oh,
did you try anything like that, Leanne?
Well, for me, and it always will be, it's being surrounded by my grandchildren. They always make me happy. And it's about lifting up that wairua. Another one, I do love miri, but then again, you've got to be careful because you could, bruising happens quite easily if you're doing other treatments. So do be aware of that. Eating good is a good weapon, but if you're doing chemotherapy, you would know that you lose your, ability to eat. And so there are other types of supplements that you can take. Some of them are like those chocolate milkshakes.
Oh, yeah, the shakes.
The shakes in there, protein shakes, yes.
Yeah.
Not chocolate milkshakes, protein shakes. They're really, really good because, it doesn't take much to have it. But, yeah, always refer back to your oncologist. If you're not feeling well, always reach out, whether it be your whānau or your doctor. That's what I found for me that works.
That's great. And the healthcare team are really happy to embrace those complementary therapies. There's some things that might interact, but, not often. And it's nice to view it as complementary to do together, isn't it? Rather than one or the other, which is...
Just a quick word to you at home. If you have any questions you'd like to ask our panel tonight, don't forget to put them in the chat box and we'll get on to those in about 15 minutes time. So go ahead and ask away. Now, Leanne, just going back to your experience of those treatments, how did they go? Because no one thinks that cancer treatment's going to be very pleasant. How was it?
It was not pleasant. It wasn't pleasant, but at the end of the day, I think, you have to try whatever it takes. Well, for me personally, I had to do whatever it takes to be here for my whānau and for myself. So a lot of it for me was going through chemo. Muscles were always sore. Then you went through vomiting and diarrhea, and that's quite natural, to be quite honest. And but there are some medicines that the doctor will prescribe that will help, ease that. You're not always in that state, you're there for a certain amount of time. Just when you think you're over that hurdle, then you've got to go back and do the other part of your chemo. But it doesn't last forever, and it is doable. You can do it. Another good thing I forgot to mention, as part of the healthcare plan was also you can ask to be referred to a counsellor, and it's really good because some of us can't talk to our children or can't talk, for me it was around the real hard stuff, and so just to talk to that person, a counsellor, I only went to twice. She was a lovely girl, but it was enough for me to say, okay, I can move on now.
Yeah, right.
Yeah.
That's great. And actually, I'm just looking at the banners behind you. We're actually advertising our free counselling. We do. Breast Cancer Foundation does fund free counselling for anyone with breast cancer. So we'll give you some details at the end of the webinar on how to contact our nurses about that. So I guess counselling seems, like a real something that you would need, and especially when you mentioned anxiety, but there's a whole lot more around that too.
Because, well, for me personally, it wasn't just it was my state of mind at the time. My body's not, everything comes down, it comes crashing down. And so perhaps even the little things was actually starting to, snowball for me. I'm going to say this, I had a naughty son at home who thought that, yes, I'm going to be there for mum and dad, and me and my husband have always been self-sufficient, strong people, and of course my husband, 3 months down the track, he had a severe stroke, and so, it wasn't about me anymore. That was always my husband. He had to take the limelight off me. So we did what whānau do best. We all got together. This daughter did that daughter did this, and as a team we worked together. And that's what I love about, what we can achieve. Put our minds to it.
And so, Stella, the DHBs do provide counselling?
Definitely. Through our cancer services. We have our psychologists as well as our social workers. I can also link into some of the community organisations, such as we have a couple of cancer navigators at Waipareta. So they're really strong and really cemented in our community, especially West Auckland. And I need to bring in, because I'm a dual competency, in terms of my nursing as well as being Māori, I bring in kaumātua and I bring in our Māori health team. So I need to sort of keep that balance as well. I can't just be solely clinical. I need that cultural to sort of balance our whānau out.
And so, Karina, coming back onto the sort of side effects that people have from chemo, as Leanne said, there's help to manage those. What happens when you get bad?
Yeah, that's right. Well, I'm mainly around the operation time when I see our patients before and after the surgery. And some of the complications that can happen there are, things like infection and swelling with seroma fluid that can build up, difficulty with healing and dressings and drains and those kind of things. And I think, we have support for people with district nurses visiting as well, which is good, and they can tie in. It's a nice link with the community. But we're always very open for people ringing us and troubleshooting those problems and popping in to see us. You don't need to be ringing a call centre and going through to get an appointment to come and see us. We give our numbers out. Same with Stella would too. Just as someone on the end of the phone to say, I've got this problem, I need to come in. And the other treatments, as Leanne was talking about, some of the side effects from her chemotherapy. Chemotherapy it's a hard medicine to take, but they have quite sophisticated medications and things for dealing with some of those side effects now as well. So if you're feeling like you're not coping with it, get on the phone to your nurse and you will have a number to ring, to call and say, I'm not coping and can you help me? And they can access the medical team easily to provide support and liaise like we do. Just to get you the help that you need so you don't feel like you're floundering at home.
Or even being put through from one phone number to another phone number. So that's why we really want you to use our phone numbers so that we can get that help to you straight away.
That's right.
And so does everyone experience chemo the same way as
No, they don't, do they? I mean, there's some classic things that, that people talk about, changes in appetite and nausea and vomiting and tiredness. We find that some people continue to work throughout their chemotherapy treatment. Some people can and they just have the days off that are their treatment. Other people, they can't. They need a lot more support. And it seems to be quite individual to how people can cope, which is why, it's good to yell out if it's not working.
And it's really good if you have a really supportive work environment too.
Yes.
So they can give that, there's that give and take in your workspace so you can still continue to work or do as much as you possibly can.
That's right. And we're often writing letters and liaising for our woman, aren't we, to show when she returns to work, can she go into light duties for a while or, if it's possible or have some understanding.
Like flexibility.
Flexibility,
Leanne, you were self-employed, were you?
Yeah.
Were you able to work at all?
No, I mean, I thought, no, that's okay. I'll just do treatment because I'm a policy writer and documents. And so, but once I started chemotherapy, everything just, there were days I didn't even know who I was, let alone. No, it wasn't that bad, but, working through the pain or issues through muscle discomfort. And so that was a real biggie for me. And, I can't make mistakes when I'm doing policy. And so, so I took the advice of my doctors and I've left that alone. I've only just started to write again. And I'm happy with what I've been able to come up with. It's been pretty
good. So my brain was going on thinking, if this was a real scenario, I'll be thinking, okay, I can pull in the social worker and we can look at maybe wins, getting other supports in, because a lot of our whānau need that win support, even just filling out forms.
Well, me and my husband, after he had a stroke, that was us. We had to apply for WIN's help. And it wasn't as bad as what I thought it would be. It was quite easy to go through the process, and that was because we had a social worker that come in. And so she was able to go along be that worse for us. But I'll say, if anything, you know, if you're starting out on your journey, you know, it is important to get the right help. And you've got it. You just look at your family, see who can do this and that, who's willing to help, and you know, and before you know it, you know, you've got a good backup team.
And to let people help, because women aren't very good at that, are we? We nurture and we look after everybody, and letting go, okay, actually, I'm not coping that great, and yes, I would like to help, you know, that's right.
And don't leave it too late, you know, because it's just one of those things where we have to admit that, this is it.
That's right.
We haven't really talked about side effects of radiation.
Oh, sorry, I missed out on radiation. Radiation is probably, I've heard some of my ladies say it's one of the most annoying treatments because of the trips to and from the hospital. It only takes minutes to do the radiotherapy, but it's the driving there and back and that people find tricky. Sometimes it can make fatigue is one of those side effects, and we don't know exactly why people get fatigue with radiotherapy. Is it all the driving to and from that could contribute? Is it because your body is busy dealing with the insult of the x-rays? And so fatigue is one of those things that people find towards the end of their treatment. It gets a bit more intense. And we often encourage women, you know, let go. So if you just need to have a nana nap in the afternoon, do it, you know, maybe don't do a full day at work towards the end if you're still working, and let people do things for you. And there can be some skin changes, of course, in the field where the radiotherapy was. Some people find it looks a little bit like a sunburn. Other people find it can be a bit more severe. And there's nurses in the radiotherapy departments to help address that and help try and protect the skin, as well as giving you various creams and things to help treat it. And they'll be monitoring you the whole way through.
And then some people stay on other drugs for quite a long time after.
Yes, some do, yes. Like some people will be on hormone therapy drugs. You might have heard of tamoxifen and letrozole. They're medicines that are given once a day, a tablet once a day for at least 5 to 10 years, which have a blocking effect to, if there are any little cancer cells that we could have missed, the idea is that these medicines can starve them off so that they're not using the hormones to help them grow.
And they have
side effects too. Sorry, they do, and they have menopausal sort of side effects for people, because it's really trying to lower your amount of hormones that you can use in your body. Just like when you go through menopause and you stop making as much estrogen, these tablets are doing that for you. So women experience hot flushes and mood changes, those sorts of things. So I think sometimes women don't probably view those things as things they can talk about as often, because they seem less tangible. They're not as obvious as a rash or an infection or weight loss or something like that. But it's really important to talk about those things, because there's help with that as well, with sometimes changing medicines and giving other things to help.
And are you on that kind of daily pill? I can't remember.
No.
Stella, do you find that people struggle with those sometimes?
Some do, yeah, definitely. Yeah. Can I just jump back to what you're saying about going into radiation therapy? You know, I was thinking of Cancer Society and the services that they offer through the voluntary drivers. So that may take it one less stress away from the family, you know, so they don't need to have to worry about.
And just do a quick mention, there is actually a unit down in, I think, Hamilton, and that's for people that live on their own and don't have that support. So just getting in contact with the Cancer Society, they can arrange for a live-in kind of, like a rehab kind of base. So you do all your treatment, they look after you, feed you, and you can go home whenever.
And yes,
come back.
Cancer Society drivers, not in every place in New Zealand, but in quite a few around New Zealand, you might find that you can get a ride to and from radiation every day, and certainly, and in some cities, accommodation right by the hospital. So if you live out of town, you're not making that huge trip all the time. So lots to think about there. There's let's see. Okay, and so recovery from surgery, is that a pretty quick kind of thing?
And that's quite variable. Yeah. I think a lot of our women are surprised sometimes at how they do bounce back a bit quicker than some other surgeries. You know, if you think about breast cancer surgery, it's kind of on the outside of your body. We're not going into joints or muscles. It's not going to hurt every time you cough and that kind of thing. So, you know, in one way, yes, you're walking up and about the same day. You can have a shower. Usually there's a waterproof dressing on. You may have a drain in to collect extra fluid out of the way, which you have to manage for a week or so. But most of the time, I think people get around okay at home and are usually in hospital 1 or 2 nights. There are complications sometimes. So sometimes people can develop infections or issues with their drains. And again, that's when you get in contact with us. Time off work with a partial, most women might have, I don't know, a week and a half to two weeks off, and at least 3 weeks off with a mastectomy, and longer if you have a reconstruction as well. Yeah.
And I guess I would say that at Breast Cancer Foundation we do offer free Pilates classes to a lot of people after breast cancer, and there will be other rehab services maybe through your hospital too. So talk to your specialist who can refer you for any of those.
As well as your lymphedema therapy, something I didn't mention either. Some people can develop a swelling in their arm or difficulty in range of movement with their arm. So there's lymphedema physio support available as well. And the Breast Cancer Foundation offers that too.
So there are a lot of organisations out there who are all trying to do their best to just help you get through it. So let's see, okay, we're just about finished with all these things here. So Leanne, can you just tell us a bit about what life is like for you today and what you would say to people out there at home who are going to have to go through some of what you've been through?
Oh, okay.
It's an easy question.
Yeah. Life is, for me, is a lot, I want to say better. I appreciate life a lot more than what I did before. You know, I take time to be with my family, really be in the here and now with them. I appreciate what other people do for me. Yeah, I've slowed down a lot, and I think a lot of that's got to do with COVID, but it's, you know, I think it's been a good thing as well. Yeah, if I was to say anything to anybody or a little bit of advice, there's a lot I could say, but, you know, communication is the key. Don't be scared. For me, it's also about, you know, kia kaha, be strong, kia mau, kia manawanui. Those two put together means hold fast the things you love. Yeah, because that's a key, yeah, to getting better. And I wish you all well.
Thank you so much, Leanne. We really appreciate you sharing that with us. We're just going to open up to questions from you at home now. So we've got a couple here, but go ahead and ask some more if there's anything else you want to add. So first question, just thanks to Leanne for sharing her story, and then a question about what an infusion is. Stella, do you want to do that?
I'll let you know. I'll just explain my role. You know, as a clinical nurse specialist for Māori, I don't just work in breast. I look after all the other cancers as well. You know, there's cancer, whether it's upper GI, urology, colorectal, you know, I look after all our Māori whānau and all these other cancers as well. And so I don't know the specifics of breast, so that's why Korea and I will be working closely together. So I'll leave you answer that question.
Infusions, you would have been referring to probably chemotherapy when you're talking about infusions before. And so an infusion is anything that's really given in a vein.
I have my chemo, which was the big one, and then they set me a path of about 16 infusions. So to me, they're like baby chemo.
Yeah. Are you talking about Herceptin?
Yeah.
Yeah, yeah.
So that's what
that's right, yeah. And that's right. And that's another kind of branch of chemotherapy where Herceptin's a really marvellous medicine that's given to some people if you test positive for this particular protein. Only about 15% of breast cancers, I think, are HER2 positive, and it's a targeted therapy. So it doesn't give you all the side effects as chemotherapy does, which affects any fast-growing cells. And so that's why people can lose their hair with chemotherapy, because it's fast-growing, for example, whereas Herceptin only targets those cells that have this particular protein on them. And that lasts for usually a year, doesn't it? So you're halfway through.
Halfway, right? Just over halfway.
Yeah,
so every 2 weeks.
And you might have a
Every 3
portacath. They put a portacath in, so a little button that goes into a major vein under the skin there, so that each time they give you the infusion, it's not hurting all your veins all the time. It's a bit straightforward.
I feel that this is the better option.
Yeah.
Than getting poked and prodded.
Yeah.
Great. And a question around hospital appointments, and what if you can't go at the time that you're asked to go to the hospital?
Yeah, not a problem. If you contact me, I'll contact the team, the breast team. I'll contact the booking clerk to let them know, this is happening, this is the situation, and you're not able to attend it. And so we usually put in place another booking, another scheduled appointment here. So yeah, we work together, we negotiate, and to see what best fits with you as well.
And Stella, is there someone like you at every hospital? Sounds like there should be.
There should be. I think there should be more Māori nurses out there. No, there isn't. I think I may be one of the only few clinical nurse specialists for cancer. There are some navigators, but I'm not too sure whether they're nurses or other disciplines, whether it's OT, PT or social workers. I'm not too sure how other DHBs works. But I'm happy to tap into anyone around the country. If I know I've got a patient down in Canterbury, I'll be contacting AAC nurse down there, just so we can make those contacts. Even if I contact a CNS down there, I'll try and see if there's a Māori team around there to support our whānau too.
So people should ask if there's a Māori, either a CNS or a navigator or coordinator.
Definitely. And if not, contact me. I can see who I know in my networks to make that happen.
We're going to have to put you on our website as a catch-all person. Anyone can contact you. Great. Now, a question about, I would like to hear which aspects of tikanga were most important to you during your treatment, Leanne, and were your needs met?
Definitely has been manaakitanga. For me, it's that relationship and the respect that you get and give. As for tikanga, well, to be quite honest, in a lot of the hospitals, they are trying to facilitate for Māori, but at the end of the day, if our Māori people can't, are not in that space, then of course you only can, do so much. But other than that, I found that a lot of the hospitals, or especially with Middlemore or Auckland, they are willing to listen. And again, during the times of COVID, it's not easy for anybody, really, but they're willing to listen.
So are there things that you think people feel are particularly important?
Well, I think when you're around your body, your body is really tapu and sacred, especially about some of your organs as well. So I think, I think we as nurses and professionals, we try and making sure that we do ask questions first. We don't go in there, we're talking through some of the processes we go through, just so people are aware what you're doing,
Yeah, that's right.
Which actually comes back to around the issue of return of tissue and so on. And so when someone's had a breast removed, can they get it back? Or?
Yes, I when they removed the tissue and that, I asked if I could have mine back, but unfortunately, COVID. So, yeah, but, you know, it was given that time to have the right karakia for us as a whānau and to make plans or, you know, on what else was going to follow after that. You know, and there's a lot in play, especially for me and my whānau. You know, we had to have a look at, you know, if things didn't work out, what are we going to do, you know, what my daughter's going to do with me. And so, yeah, just to have that support from your staff was awesome. Yeah, plus in the right.
I had to return a tissue to one of our whānau, and it was quite an emotional, a spiritual process you go through. You know, so I'm looking for our kaumātua to make sure that we're doing all we should be doing in terms of tikanga around in our GHB, getting our kaumātua to bless it and to bless my journey with returning this tissue to our whānau. So it was quite emotional. I thought, you know, because this is her. You know, I'm in charge. I'm kaitiaki of making sure that she gets herself back fully.
That's right.
And she said she couldn't move on because this was something that was sort of holding her back in terms of her wairua. And this was something that sort of completed her once she got it.
Yeah, that's right.
She was able to settle.
Yeah, really meaningful process for everybody.
And it should be part of the consent form as well. So someone should actually ask you, would you like your tissue returned? And then there's a tick box, a signature that you put on there. Sometimes the tissue is held for at least a month because of the testing, but to reassure you, it's handled very nicely and carefully. So, and I love that what you said, Stella. That's really special. You know, that blessing. That there must be a sense of, I don't know, is it a sense of closure or like a returning?
For me, it was about respecting my body.
Yeah, right.
You know, and you know, it was about my tupuna come into play as well. You know, and so having that part of me, you know, brought back and then put to, you know, back at our urupa, it meant, you know, that was a little, you know, something that had to be done. Yeah, but the karakia for me was where it stood for me. And to be able to go to the hospital just before my operations and have that time to karakia and get ready for my op, because it was very scary, you know. And yeah, just to have that part. And the staff, again, they were, you know, they were awesome.
That's good.
You know, they respected that part. Yeah.
So in general, when it's not COVID, you can bring plenty of people along with you to appointments?
Yeah, we encourage it. I mean, it might be different in different DHBs, and I think they have rules in pre-op sometimes about how many people, because it's a safety thing, but mostly I think we would try and accommodate. It doesn't look like it when you come in, you know, sometimes it's very clinical. It looks like there's not much room, that we don't provide for larger groups, but we have a whānau-centred holistic model of healthcare, and we like all that support, because we understand that, you know, that helps our women to get through it, just like you're talking about your karakia before your surgery. What is that? Yes. Yeah,
it's all part of that healing process.
Yes. Yeah.
You know, and staying connected. Yeah, because without it, it's sort of like Māori. Well, for me being a Māori, it's like, you know, floundering around in the dark.
I think for me, we need a bit of a heads up sometimes, because our rooms are really small, and we'll do all that we can to accommodate that as well. I had one of our doctors come across to our whānau room, you know, just because of the bigger space, and the whānau could be in there, and it was a lot more comfortable. So, you know, we can make things happen.
That's great. And someone at home has confirmed that indeed the tissue return was on a consent form, and that's a great thing to happen. So that's good. Thank you for sharing that. Now, another question back on lymphedema. I was told about lymphedema, but I haven't had it. When do you get it?
Yeah, that's a good question. So lymphedema can happen. It's a fancy name, but it kind of, it's a result of having lymph nodes removed, and lymph nodes are they're all over our body. They're the things that get big when you get the flu, because they fight off infection and help drain away waste fluid. And there are different places in our body, and they're significant with breast cancer because it's the easiest place for a cancer cell to get to if it's going to try and go somewhere in the body, which is why we need to remove them, some of them, and sometimes more of them at time of surgery. You've got lots, 20, 30 or 40 under each arm, but the more we take, the higher the risk of lymphedema. And lymphedema is when the lymph nodes that do their job taking that fluid away, if they're not there, there can be a backlog of fluid in the arm with those little vessels that drain that waste fluid away. And that can be, it's usually permanent if it happens. It can happen at any point in your life after having lymph nodes removed. It's not very common, but you may have seen women wearing a full sleeve. Some women just say their rings are a little bit tighter on that side. And there's help available for that. So after surgery in our DHB, we refer you to our lymphedema team, who will see you a few months after surgery, do some baseline measurements and provide education on what things you can do to try and prevent lymphedema and what to do if it happens. And some of the things that can cause it or be a catalyst to it, if that's the right word, is maybe having an infection in your arm that puts extra pressure on those lymph channels to drain that fluid away. So if you have a cut on your hand and you're about to go gardening, cover it up first, you know. Just be aware of those kinds of things.
Did you have lymphedema?
No.
Yay.
Yay. Very knock on wood.
Okay, we are running. Someone else has said that if your arm is use the acronym HAT, H-A-T, if it's heavy, aching, and tight, get your arm seen to.
Great. Yeah.
Like that.
Yeah. Good.
Yeah, heavy, aching, and tight. So that's good advice. Yeah. Yeah. Or even one of those three, maybe.
Yeah.
Rank. Yeah.
Any of those things.
Yeah,
that's right. And again, if you think, who do I ring? You know, of course, we haven't mentioned GPs much, but they're an excellent source of help as well in the community. But also keeping Stella and my number to call and say, I think that I've got this. What do I do? And we can liaise with the right people to see you.
Yeah. And that's a good point about GPs. We often hear that the GP can be a really important person. Was your GP important for you?
Yes and no, because I swapped doctors, just before I found out I had breast cancer. But the doctor I have got now, he's very, thorough with my care, and he'll take the time to go along and ring up and just check up with the specialist and see what's going on.
Okay.
So he's good.
Do you get to talk to GPs much, or do you find that phoning?
They're pretty, I don't do that often. I mainly work with the breast team or Radonc usually, for first point of call. Yeah.
So it tends to be the GP who might look those 5 years that you're on those pills afterwards. You might end up seeing your GP a bit about those symptoms. Okay.
We often will tie in with the GPs as well and breast clinic. If even with referrals to us, if we want to discuss something or a person that we're worried about and that kind of thing as well. So they can be. But we often think, it would be nice to have that link between primary and secondary care more. So meaning the GPs and then the treatment people, because we know that continuity of care is really important for our wāhine, and knowing that we know each other and we liaise for you, like it's quite reassuring for people, isn't it? So we try and do that.
Okay, well, I think we've answered all our questions and we're nearly out of time, so we'll just wrap up. So just want to say a big thank you and kia ora to all our panellists here. Thank you so much, Stella and Leanne and Karina, for your help. And kia ora to all of you at home too. Thank you for joining us tonight. When you leave the webinar, you'll have a little survey pop up asking you a couple of questions about what you thought of it. We'd really appreciate if you could just take a minute to fill that in. We also will have some information on screen, I think, about our nurse line and other services. So here we go. There we go. During office hours, you're welcome to call our breast nurses here at Breast Cancer Foundation. Of course, you have your team at the hospital or whatever, but our nurses are on duty on weekdays too, and happy to talk to you and answer your questions. We have an online community, My BC, which is a place for you to meet other people going through the same sort of treatments that you are.
Nice.
We'd love to see you at another of our webinars. If you are having any of these treatments, we've talked about chemo and tamoxifen and so on, we do have webinars specifically for managing side effects of those things too. Those have proven helpful to lots of people, so check those out. I think that's about it from all of us, and thank you to our producer Julia, who's done all the technical work tonight, and we'll see you next time. Ka kite.
Ka kite.
Ka kite.